Happy Thursday, Baby Steps Nutrition community. Welcome to another edition of Instagram Live. I'm excited to speak with someone who actually I met a couple years ago. Her daughter and my daughter were in the same class. And it's only recently when I discovered that her and I share a lot of similar passions, and also I absolutely love her story and I wanted her to be here to share it with all of you. I'm just waiting for her to join us. Dr. Uma Lerner specializes in reproductive psychiatry, depression, anxiety, bipolar disorder, ADHD, life transitions, grief, and loss. She has expertise in management of psychiatric and emotional challenges during pregnancy and postpartum. Today, we're going to be focusing a lot on the barriers in women's health. And while I wait for Dr. Lerner to join us, I'm going to give you a little bit about her background. Dr. Lerner graduated with a BA in sociology from Rice University and received her MD at the Baylor College of Medicine, the Menninger Department of Psychiatry in Houston. She completed her residency in psychiatry at the University of California in San Francisco, and subsequently the Foundations of Psychoanalytic Psychotherapy program at the San Francisco Center for Psychoanalysis. Dr. Lerner is board certified. She used to live in California. She now lives abroad, and we're going to be talking about her background, her story, her life's passion. I'm just going to see if she's here. Let's see. Hi.
Hi,
It's
how are you?
good. How are you?
I'm doing well. It's so good to see
It's
you.
so good to see you. I hope there weren't any connection issues. Sometimes I know with Instagram, and it is live, so anything goes really.
It's true. It's true. But I'm glad we found each other. I'm trying to get my camera in the right spot. There we go.
How have you been?
I've been good. How have you been?
Good. I was giving a little bit of introduction to you. I was hoping that you would come on and share it, but we can get right into your story actually.
Okay.
I would love for you to share, growing up, what that was like, and then, going through life, personally, professionally, your experiences. You're also a mother to a daughter. So I know that, adds the whole other element of both the challenge, the passion, the interest, curiosity.
Yeah. Well, those are all such good questions and covers a whole lot of topics. But let's see. I guess in terms of what shaped like the kind of work that I do, which is probably most relevant, I guess, to you or to your audience is um, my work as a reproductive psychiatrist, being interested in women's mental health. And then also, I have a deep interest in international people and migration and travel and women globally. So, so maybe let me talk about how that got shaped for me. So, I guess one thing is my mother's mother, my grandmother, died in childbirth, and my family is Sri Lankan Tamil, and healthcare was very different back then for everyone, and particularly in Sri Lanka, and people gave birth at home usually. My mom is the eldest, and in my grandmother's third pregnancy, both my grandmother and the baby girl died, which was actually pretty common in those days. So my mom never had a mom, and or she suffered the loss of her mother. She was 4, and so she never really had a mom after that. And as my mother's daughter, I could feel the impact of that throughout my childhood, throughout my life. So I think that's something significant that shaped my desire to want to address women's mental health and women's health issues. And then the other large thing that shaped how I am today, or my career and views, was the war in Sri Lanka. Throughout the war and then the eventual genocide in Sri Lanka, my parents helped Tamil refugees in the United States, and our house our home was a kind of way station for people fleeing the terror of war and trying to build a life in the States. And so their stories, talking with them as a young child, their lives shaped a lot of how I view the world. And to kind of bring the two together, war, ethnic strife, political conflict affect everybody of all genders, but very often many of the strategies of conflict are carried out on women's bodies. We see it right now in the war in Ukraine, where Russia is using rape as a weapon of war. And we see it in the United States, where legislation regarding women's bodies is used as a political tool for power in this really highly polarized society we have right now.
Yeah, and I was just thinking as you were talking too, it's 2023 and we're still, I feel like I want to celebrate all the changes and evolution that, women have made in terms of rights, but we're still so backwards. And, and unfortunately, most women in the world are still suffering, a lot of young girls, women, right? And those are the conversations that we need to keep having. And one of those big topics, right? This is something that millions of women every day in the world have are periods. And to think that there's still so much stigma around something that naturally our body has to go through, right? I mean, whether we like it or not, it's something that happens and it has to happen for all the obvious reasons, but there's still so much stigma around that. And so women around the world still are being treated as they are because they're having their periods. What are you seeing there? Let's talk about the role that the periods actually play in the treatment of women worldwide.
Yeah, I mean, so the term to kind of cover what you're talking about is called period stigma, and it covers a whole range of issues from lack of education for young girls about their period, to shame in asking for a menstrual pad or a tampon, to even being fully excluded from community when a girl or a woman is on her period. To personalize it, traditionally in Hindu communities, girls are not supposed to go to temple while they're on their period because you're considered to be like unclean. And at the same time, in many Hindu communities, temple is the most important social hub. So if you're barred from attendance, you're effectively barring a woman from community, period. I mean, that's a very big deal. Luckily for me, my parents never barred me from any activities because of my period, and my dad was very comfortable going to the store to buy maxi pads for us. And I think that my confidence and academic achievement is directly tied to the comfort and confidence that I was able to have with my body and my menstrual cycle as a young girl. The other term that kind of covers what you're talking about is period poverty. And that covers things like a lack of access to sanitary products, menstrual hygiene education, toilets, hand washing facilities, waste management, stuff like that. And in much of the world, girls have little to no access to period products. And so when a girl or any person really is unable to take care of her body in the most basic way, then the result is that she's unable to go to school, she can't go to work, she can't run errands, she can't protect herself. Looking at Afghanistan, one of the first changes that the Taliban did was to get rid of the female days in the small village communal baths. And in such rural places, there's no other way for a person to clean themselves. And thus females end up becoming more susceptible to infection, to illness, and death. And, people think that maybe this isn't a problem that affects the Western world, but Bloomberg in 2021 reported that prices for maxi pads rose 8.3% and tampon prices rose 9.8%. And now we've had 2 more years of inflation, so I'm sure prices have risen even more. I don't want to make it seem like all bad. I mean, things are changing for the better. In 2020, Scotland became the first country to provide menstrual products for free to anyone who needed it. And now there are 10 countries that provide period products for free in schools. In the United States, Illinois, New York, Washington State, New Hampshire, and Virginia have legislated that menstrual products be available in school. But we still have 44 states plus territories to go. And the schools are a very important
Yeah.
site because there was a study in 2017 that showed that nearly 1 in 5 US girls had either left school early or missed school entirely because they didn't have access to period products. Um, and I work as an advisor to a period app, Avia, and they have a user base of girls mainly in their adolescence and early 20s, US based. And through working with them in their research and their outreach, I'm often really shocked at how many girls and young women in America know little to nothing about their menstrual cycles and how to take care of their bodies. So we still have a really long way to go.
Yeah, and I also feel like it's not just women that should know about periods, the men should, because their partners, their brothers, their husbands, I mean, we live in a world where everyone is together all the time. So we should also be educating the men as well, and little boys too, right? And I love that some of the conversations I have with some of my mom friends, especially those who are advocates such as yourself, they're having those conversations with their little boys. Like, today mommy is on her period and this is a pad, and so they're trying to stop that stigma that happens within the home, so that that child, as they grow up, can go out into the world and be comfortable around the
It's
idea that
so
they have periods.
That's right, because period stigma is perpetuated by both genders, men and women, girls and boys, and in the home, brothers, fathers. During COVID, I was reading a story about how this girl didn't have access to menstrual products throughout COVID because her dad was the one who did all the shopping and she was too embarrassed to ask him to buy anything for her.
Yeah, so all the reasons why we still need to be having these conversations. And going back to puberty and development, right? I want to talk about, you were quoted in an article, and I have been reading more and more about this, that when young girls start puberty, the rate of anxiety and depression skyrocket. What's happening there? Because we know it can't be just hormonal. What's happening in society, or is it mostly hormonal? Can you speak to that?
I mean, I think people like to give a hormonal answer because that's a pretty easy kind of quick answer, and it puts all the responsibility as a medical thing on that individual. But more and more I really try to hold back from using a medical model to explain everything. If so many people are going through the same thing, then it has to be at a societal level, not just a personal level. And I think if we think about like missed school equals missed opportunities and a drop in confidence. And I just said, 1 in 5 girls are missing at least part or an entire day of school because of a lack of period products, and then probably even more because of period symptoms. And so when this occurs, this missed school occurs during puberty, which is like junior high, right? The missed school is occurring just as academics and the social landscape is getting more complex.
Mhm.
And any loss of learning or social opportunity for anybody at that age is an issue. But specifically, when you apply this to girls, young girls who don't receive a full education are more likely to enter marriage too early and are more likely to face early pregnancy, domestic violence, and pregnancy complications. So these have very serious gender-based consequences later on in life.
Yeah.
And, I
Yeah.
really think school can be attributed to period stigma, right? And so that period stigma disempowers girls and causes them to feel embarrassed about a normal biologic process, and then leaves them unable to properly manage bleeding, cramping, or any other period related difficulties.
Yeah, and I love how, like, we're talking about baby steps, but a lot of companies now, starting at grassroots movement, are producing feminine hygiene products, but they're also part of their campaign is to raise awareness. So, there's a lot of videos out there. They're bringing in a lot of people of various backgrounds to talk about not just the product, but their messaging. So I like that we're going in that direction. So it makes it a little bit easier for our girls, right? Because then they're going to be being raised in this world, and then they're eventually going to be mothers if they choose to do so. So, it's never too early, I feel, or too late to start.
That is exactly true.
Uma, you work a lot with children as well, and something, there's a lot of talk about trauma. And sometimes I know that word can get thrown around very loosely, and there's a very specific definition of trauma. We know there's early childhood experiences, and to some degree, no one really has a perfect childhood, right? Everyone has certain experiences in life, and some have very, very difficult experiences that can affect their childhood. I want to go back to, it was one of my ultimate favorite TED Talks, Dr. Nadine Burke-Harris, who was the Surgeon General in California. She did a TED Talk about this very same topic, how early childhood experiences, adverse childhood experiences, the ACEs, can impact a child's development. Can you speak to that in terms of what you're seeing in your practice and children that you've worked with, and just globally, all of the things that you've been involved with?
Well, yeah, it's an important topic, and that I saw that TED Talk, and it's a great TED Talk, and it's based on a very important study. So let me backtrack a little bit and maybe give some background and all that. So, so her TED Talk was based on the Adverse Childhood Experiences Study, which was a research project done in the mid-90s by the CDC and Kaiser. And they looked at childhood traumas. What they included in their definition of childhood traumas were physical, emotional, or sexual abuse, physical or emotional neglect, parent mental illness, parent substance dependence or incarceration, parental separation or divorce, or domestic violence. And what they found in that study was that high numbers of childhood traumas are correlated with high risks of hepatitis, depression, COPD, lung cancer, heart disease, and suicide. And so then that begs the question, why does this happen? And one hypothesis is that children are especially sensitive to repeated stress activation because their brains and their bodies are developing. And Dr. Burke points out that high doses of adversity not only affect brain structure and function, but it also affects the developing immune system, our developing hormonal systems, and even the way our DNA is read and measured, and read and transcribed. And we've seen studies on that on MRI scans, we can see measurable differences in the amygdala, the brain's fear response center. And we find chronically elevated levels of cortisol, which is a stress response hormone. And that is a hormone that is actually toxic to the body with prolonged exposure. Cortisol is meant to be released for short-term stressors like running from a lion, or running to catch a gazelle if you are the lion, or maybe for a last-minute cram session before finals if you're a student. But it's not healthy in a daily, ongoing psychic stress kind of way.
Yes. So
And
this is where it's good to mention not all stress is bad, right? So we're talking about consistent and high levels of stress, right? Because
that's right.
we know there's also a difference. In some families will say, well, it's good to teach your kids resilience, and there are going to be situations where they have to overcome, but we're not talking about those situations.
That's right. And especially also when we think about stress in the home, the additional difficulty with home-based stress is then what is that child's safe space, And it's for sometimes that safe space could be the school, but sometimes, the whole community is a stressful place. And now with iPads and iPhones and all that kind of stuff, kids have bullying at school, but then it follows them home through texting and social media. And so then there is no safe space to get a break from that cortisol. Dr. Robert Bloch, the former president of the American Academy of Pediatrics, said that adverse childhood experiences are the single greatest unaddressed public health threat facing the nation today. And there's this new push with our current Surgeon General to take on mental illness and trauma and suicide and all the threats that our youth are dealing with. Dr. Harris called childhood trauma a public health crisis, but I would actually go further and say that high levels of childhood trauma are collectively representative of a toxic society. And at this point in our lives in this country, we have multiple public health and cultural issues interwoven here, including our relationship to guns, the premium we place on individuality, the deep political divide in our country, social media use, the lack of a safety net that allows a person to become homeless, and the huge gaps in education and healthcare access.
Yeah, and we know 2020 really highlighted, right? So people said, well, that's the reason why. And I feel like 2020 really highlighted or amplified the struggles that people already had. And then of course, taking away what the social isolation and lack of access to care, and children not having access to, say, just their one meal a day through a school lunch program, and also not having that safe space, like you said, being at school. So being in, a lot of the homes where there was a lot of trauma, right? Chaos, abuse. So we definitely saw the rise in those statistics, unfortunately.
Yeah, yeah, but hopefully now we have a greater awareness of it. I think it is on the radar. And then I think we really do need to look at this from a social, societal standpoint of what is going on in our society that so many people are suffering this way.
Yeah, and how do you feel about trauma-informed care? So we know not every person who works with children can go out and do a course, but how important do you think it is to be aware of, like we talked about the ACEs and the ACE study, when you're working with children or when you're around children?
I think it's hugely important. I think just to like have that on your radar, right? To ask the question, to wonder about a child's social environment at home and at school as well. Like, do you have friends? Do you have teachers that you really like? What is your home like? How do you get your menstrual products? Like, just to find out, ask these questions to give them an opportunity to answer if they feel comfortable.
And then what are some of your own trusted, reliable sources? We know with social media, with online, there's a lot of stuff out there. There are a lot of headline news, and sometimes it could be so overwhelming. Not sometimes, all the time. I'm always overwhelmed about what's out there and what is the trusted source of that information. What are some of your go-tos, or what is some of your advice for people to get credible information?
I actually, I don't know if this is the answer you want to hear, but beyond just continuing medical education for my own work purposes, I try not to. I think that the best thing that we can do is stay in tune with our own body and our own mind. Like, be in your body, be in your mind, notice how you feel. Do you need to rest? Do you need to move around? Do you need to talk to a friend? Do you need quiet? There's so much, like you said, that's like overwhelming in social media and the news, and and some of it is good science and some of it's not. It's hard to know the difference. Trends are trends, but your body is for your whole life. So, and the messages in your mind are the messages that you hear the most. So I think it's so important to take care of yourself, and not that catchy self-care of Instagram, but to actually take care of yourself in the way that a loving mother would take care of you.
Yes, and I like how you said trend and self-care, because that's become, right? It is, it's become trendy. And so that's become another source of overwhelm and anxiety for a lot of women, especially, like, oh, it's one more thing to do. And then I'm not doing this correctly. So I'm feeling more frustrated, which defeats the whole purpose of self-care in the first place.
That's right.
I wanted to ask you, in terms of healthcare policies and legislation regarding women's health, how do you feel about the current advocacy efforts? Where do you see the direction of this going? How can people get involved if they want to?
Well, I think there are so many places that people can and there is a need to get involved in terms of women's health. Um, you know, I think that encompasses so much, including healthcare costs and healthcare access to accurate information, which we kind of just talked about, menstrual education, sex and relationship education, and of course, birth control and abortion access. And I think there are two levels to have this conversation. One is at the individual level, and then one's obviously at the social and political level. At the individual level, which I would include like family, school, doctor's office, I think we need to really normalize. There's still a lot of work that needs to be done in normalizing conversations about period, health, sex, and relationships. And I think that's like so crucial to reducing shame and stigma, and also to be able to effectively support women and young people. And then on a larger scale, I think at whatever issue that a person might care about, that you might care about, like poverty, immigration and refugee issues, natural disasters, homelessness, to think about period poverty as part of that issue, right? Like if people are evacuating a fire and having to stay in like a makeshift disaster shelter, a lot of those women probably need period products.
Yeah, and something a friend brought to my attention, even when you're driving around, and people like to give out Ziploc bags of stuff, like essential products, when you see someone who's homeless on the street. But something to include would be feminine hygiene products, because that's something a lot of people that are on the streets don't have access to. So that's something
That's right.
that I'm going to start including in my own kits
Oh, good.
when I'm out there. Yeah, it's just things like it's important to, like you said, once we know, then we can do those things. So
That's
are there
exactly.
any organizations online or otherwise that you recommend to our viewers that they can go to get up-to-date information, or just ways that they can get involved?
Well, I mean, there's so many things happening right now in terms of, just like locally in San Francisco, there's a huge movement around trying to address homelessness, and there are different organizations and ways that people are approaching it. There's a huge issue around um, moving towards like a harm reduction approach in terms of drug use and like clean needle distribution sites and safe use sites. There's a lot, we always in California have issues around fires and evacuation. So I would just, in any of those things that you care about and that you follow, just remember girls and women and our menstrual cycles.
Yeah. And I love that you said individual levels, so starting from within the home and speaking to our children about it. And I always say, if there's a way that you can be helpful, then why not take it upon yourself to do that, right? Especially if you're in a good place yourself and there's so many people that need help, find ways to get involved. And it could be different for everybody, but little even
Right.
goes a long way.
That's right. Yeah, it can be different for everybody, but I probably, whatever it is that you care about or you're involved with, women's periods relate to that somehow.
Totally. And Dr. Lerner, where can our viewers find you? I know sometimes you're not taking on new patients, but what are ways that they can access some of the things that you've shared?
Well, I have a website, www.umalernermd.com, and so you can find me there. And I work with Avia, which is a period tracking app, so you could find me there as well. And I always love to hear about people and answer questions if you want to reach out to me.
Yeah, and actually on the topic of period tracking, how much do you recommend that? I know that's something I got into recently, and I feel
Uh-huh.
like I wish I had done it sooner.
Yeah, I think I really do recommend it because I think it's like if you do it for a little while, you don't have to do it forever, but even if you do it for a little while, then you understand the rhythm of your body, and you get to understand, you figure out the sensations that you're feeling and what they might mean. And then you maybe don't need to track forever. You kind of got it and you can kind of carry on. And if something changes, then you could like go back to tracking again. I think people do it in terms of like tracking what they eat. Sometimes that helps you do that for a little while and you figure out, oh, okay, and then you don't have to do it forever. I went surfing recently. I took a surf lesson and I was standing on the beach with the instructor and like looking out at the water because I was really confused. I was in the water on my surfboard, not really understanding what was going on. He's like, okay, when the wave comes, start paddling. I was like, but how do I know if the wave is coming? The wave is behind me. And then we got out of the water and we stood on the beach and then looked, and there was a pattern to the waves, and there was like currents and things that I could see outside of the ocean, that when I was back in it, I was like, okay, now I get it. Now I know what to do. And I think period tracking is like that. If you track your period, then you're like, oh, I get it, why I have better focus maybe at this time of the month, or why my libido shifts at, at certain weeks to other weeks, or my mood shifts. Now I get it, and I know what's happening. I'm not as much out of control. I have agency.
Yeah. And that's the beauty of some of the things that are out there related to technology is I feel like it creates self-awareness. And when you
Mm-hmm.
start with yourself, then you can start to understand others as well. Dr. Lerner, thank you so much for being here. I know we're going to have a podcast interview and we're going to go really dig deep into some of these questions related to barrier in women's health, period health specifically. And for our viewers, if they have specific questions for either of us to send those along, we'd be happy to answer them. Thank you so much for being here. It's Thursday. I just don't know where the days go. But I love that we can end the week right with these great conversations. So thank you so much for being here. And thank you to everyone who joined us today. And again, if you have questions, do reach out. We're very easy to find. Thank you.
Thank you.
See you soon. Bye.
Bye.